free to share that with your colleagues later on. We will also have an evaluation at the end of the presentation. So once we open things up for questions, a poll is going to pop up on your screen with an evaluation of the town hall, of the presentations. It's just a few questions there. We really ask you and encourage you to complete those just to give us feedback on what's helpful and maybe other ways that we could share information. We have a link to a SurveyMonkey if you want to give feedback on other topics that would be helpful for us to cover, other trainings. We do a lot of different events. Please, we'll share that link and please fill that out. That really helps us. We've always developed our programming here at the consortium in response to the needs that are identified by our members and our network partners. So please, if you have any itching desire to learn about another topic or program, do let us know through that SurveyMonkey feedback form. I think that is all for the logistics. So to tell you a little bit about the consortium in general, we do a lot of work. We do trainings and events to help support frontline workers in healthcare and housing and social services who are serving a population of people who are homeless or unstably housed and have chronic medical or behavioral health issues. We do a lot of work to kind of bridge the divide between these different sectors and get people working together and communicating better and supporting, helping you to better support your patients and clients. During the COVID-19 crisis, we've understood that it's very urgent to get information and resources out there. So we've been doing these COVID town halls as a way to bring in government officials or industry experts to talk about different topics and get that information out to you. And we heard from a lot of people that food insecurity is a major issue right now. And so we wanted to be able to provide some information on some food assistance programs, what's new or different during COVID, and how you can access those. So that is what today is about. And I would love to introduce our two speakers who we're very delighted to have. Gabrielle Williams is the Network Capacity Manager at City Harvest, and Dorella M. Walters is the Senior Director of External Program Affairs at God's Love We Deliver. And for those of you, I know I don't usually like to read off slides, but I know some people just call in, so you're not seeing what we're seeing. So I'll just do a quick read of their bios. Gabrielle Williams is the Network Capacity Manager at City Harvest. Passion for this work is embedded in the love of feeding people. Her time at City Harvest, she has worked closely with their network of food pantries, soup kitchens, and external partners to manage operations, develop programming and tools, as well as research to address needs across the network. Prior to her tenure at City Harvest, she was trained as a professional chef and has a degree in anthropology with a focus on food, sociolinguistics, and communication. She's a Queens native, which has deeply impacted her understanding of food and how it shapes tradition, community, and general well-being. She's also a mostly successful gardener. Gabrielle, I hope one day we will have a Queens Health and Housing Consortium, and maybe you can help us when we do. Dorella Walters is the Senior Director of External Program Affairs at God's Love We Deliver, an agency that in 2019 delivered 2 million nutritious, medically tailored, high-quality meals to men, women, and children living with HIV/AIDS, cancer, and other life-altering illnesses in New York City and Hudson County, New Jersey. Dorella is responsible for representing the agency in both healthcare and community settings to establish and maintain contracts with managed care organizations, hospital systems, and community-based organizations. She previously oversaw client enrollment and care management, contract management, and outreach efforts for the agency. She's a graduate of Long Island University and received her master's in public administration from Baruch College. She's worked in the nonprofit arena of social and nutrition services for more than 20 years. She also serves on the HIV Health and Human Services Planning Council of New York City and currently serves as co-chair of its Priority Setting and Resource Allocation Committee. We are so honored to have these two wonderful speakers with us today to share about their programs, their organizations, and what is out there that can help the people that you all serve. So with that, I will hand it over to Gabrielle.
Good afternoon, everyone. It's nice to be with you today. I'm sorry my camera is not working, so I will just be a voice, but hopefully a voice with some guidance for things that you need or might be interested in. City Harvest was founded over 35 years ago. We're the city's first and largest food rescue organization. Last year, for fiscal year 20, our goal was to move over a little over 67 million pounds of food. And then COVID came and that need increased drastically. And so before the end of the year, we delivered over 81 million pounds of food across New York City to our agency network, the mobile markets that we operate on our own, as well as emergency pop-up sites. There are several resources that I'd like to go through with you. Carmi, I'm going to ask you to switch to this next slide if possible.
Gabrielle, are you able to share your screen?
Oh, yes. Just give me one moment. I'll talk you through this and then we'll arrive. Just one moment. So part of our response efforts at City Harvest have been to shore up areas of the city that don't have enough food access on a regular basis, and then also make sure that the agencies that we support are adequately, if not over adequately, supplied with inventory. The way City Harvest operates is that we rescue food within the 5 boroughs of New York City, and we also source food from farmers, produce brokers, and through Feeding America, which is kind of the umbrella that we do fall under. And so our teams have worked day and night to bring in new sources of food, moving multiple millions of pounds of food a week. Just today I was in a meeting, and this time last year I think we were moving around 600,000 pounds in a week. This week we'll move almost 1.6 million. Just give me one moment, folks. I'm sorry about that. My computer has trouble sometimes. While this attempts to open, I'm just going to jump into the more important pieces here. So
in the meantime, do you want to just bring up the PowerPoint?
Thank you for that. I apologize, it would not connect for some reason.
All right. Thank you.
Thanks. So just to tell you a little bit about some of the ways that we get food across New York City. City Harvest many years ago started doing our mobile markets, and mobile markets are farmers market style pop-up distributions, often in partnership with NYCHA or a community-based organization with a large space. Our team operates these markets, and so they bring all the food there. We manage that with distributions with our mobile market managers and volunteers from the community, and sometimes externally. And there's usually some boundaries around who can access those markets. At this juncture in time, to manage the wildly increasing need with COVID, those markets have been opened up. There's 9 of them across the city in all 5 boroughs, and they are all happen on one weekday and one weekend day a month. And I will show you how to access where those markets are. We also have community partner mobile markets, a program where we partner with a group in the community, again, a social service organization or community-based organization more often than not. They manage the distribution themselves, and we supply them with everything that they need to get that off the ground. There are 15 that we currently work with. And with COVID, we also faced a couple of other issues. The agency network that we work with on a daily basis, many of them had to shut down due to a plethora of reasons, whether they it was to protect staff, whether it was because somebody may have gotten sick and they needed to take the proper precautions. And also some of them are smaller operations with less capacity. And so they took those orders from the city very, very clearly and needed to take a break for a time. So there was an increased need. There were agencies that stayed open that started moving double, triple, quadruple the food that they usually do and seeing the same in clients. And there were also pop-up distributions. So many people reached out and wanting to move food, and our team, it takes a lot of time to vet them, make sure that they have the right tools to do so, and get them a regular supply, whether that's 1 or 2 or 3 times a week, to make sure that they can feed a community that might not have as much access to a food pantry or soup kitchen. And also, we wanted to make sure that there were neighborhoods that were being more affected that had even more supply available. And then as the network reopened, we've worked to get even more food out to our agencies and trying to do that just in time. City Harvest is unique in that we run all of our own logistics. We have a fleet of 22 trucks that we use to pick up food and also deliver food, so whether that's from our warehouse or donations. Our offices on 32nd Street have been closed since March, but our warehouse is very much open on 6 days a week, and we have trucks on the road 7 days a week. We revamped our volunteer program. We've brought on additional staff to repack food so that agencies can distribute it safely. And also, we have we shifted our operations. So for disaster response purposes, many of us don't do the jobs that we usually do. Our jobs have been rededicated to make sure that our field staff and the agencies that we work with have even more support. So what I'm going to walk through with you now are 3 things. 2 things are bigger than the other. One is a map that we have available on our website that is super handy for finding food. You can tailor it however you need to, based on about 7 or 10 different data points in the map, and then it's as simple as putting in a zip code so that you can see what's available in your area. The second is Plentiful, which I'll get to after that. Plentiful is an app that we actually collaborated with several other food funders in New York City to build, and it's an app that pantries can use to create appointments and sign up clients so that they can easily track that. They are required to give service statistics every month, so this helps them do that, but it also helps any client who's looking for food find a pantry near them, and if possible, make an appointment to visit that pantry. So I'm going to just click over, and I'm going to share my screen with you all, and we'll walk through all of this now. This is the City Harvest main landing page. You can go through this and see a number of other pieces of work that we do, including policy and government relations work, information about our donors, how to become a donor, where agencies are, other campaigns and information. But the most important piece today is this area here, need help finding food. You can also easily get here at the top of the page. There's some mobile market information here. I'll show you really quickly and then we'll go back. You can look at the markets by borough, and it just gives you some basic information around where the markets are and how they operate. Right now they are more open so that people who just need to access them can. They're bringing more food than they ever have. They're serving more clients than they ever have. And if we click back into food, get help finding food is the key section here. There's an email address, foodhelp@cityharvest.org. It is it's manned by a staff member at all times, so they're very quick to get answers back to folks or dig around for information you might be looking for. But we also have this map here, which is very handy. In this map, we have, if we click these arrows, our markets, agencies that are closed, where things are in relation to the subway system, DOE food hubs, all of that. And I'm actually going to click off a few of these things. Let's take off these. These few options here would be key. Our mobile markets, our community partner distributions, emergency relief sites, and then open soup kitchens and food pantries. City Harvest serves about 400 across the city, 400 programs. There are closer to 900 programs across the city. So this is a full map of everything that's available in New York. It's being updated weekly as far as I have last been informed. And so this will let you know where the agency is located, contact information for that agency, and their times and days of distribution. You can click in and out and add more important pieces of information, whatever you're looking for or your clients or patients might be looking for. And then you can also very simply put in a zip code to see what is near you. So I'm going to use 011 for argument's sake. And in this area, these are all the emergency feeding programs available, whether they're soup kitchens or food pantries. And then if you click them, information comes up around their service. So this is Holy Apostles, one of the biggest soup kitchens in New York City. And they're a great program. Their address, how to get in contact with them, and also most importantly, their hours of operation. Their website's available if there is one. And this should be, even just using this as a staff member who works at City Harvest, I've worked with the agency network for 6 years now, and sometimes you just forget exactly where somebody is, or somebody might have closed, and you need to remember. This map has been super helpful in doing that, but also it is a great tool if you're not familiar with the network of soup kitchens, food pantries that are available for clients to access. And again, it's right on the main landing page, need food, get help finding food. And it will bring you right to this page. The other thing I'm gonna click over and show you is Plentiful. Let's get you guys back to the main page. So Plentiful is an app. It's available on Android, but it is also very simple to use. It's as simple as texting food to pantry, so the numbers for pantry, which are also in the presentation. And you can figure out what is available near you. So again, downloadable. You can search by any kind of amenities you might need, whether there are any accommodations that might be needed. But it's also pretty up to date because this is how pantries manage themselves directly. So when you use this, you're very often getting the most up-to-date information because it's pretty robust on their end. So they can message clients, they can get back to you. There's ways to communicate if there's closures for a storm. Many pantries will send out a note so that people know not to come that day. And if they use the reservation system, you can make a reservation to pick up at that pantry, which allows you a little more freedom. The main impetus for this is that we have lots of lines for pantries across the city, and we want people to be able to access what they need in the time that they need to. So to maybe reduce those lines and also give people some of their time back and help pantries know how many people they're serving, this was a huge push for Plentiful. But what's also great on here is that you can see across the city where Plentiful pantries are located, what pantries they are, and then also have a better idea of what's in your community and where you might want to make an appointment or when you can make an appointment. So I'm going to, looking forward to any questions you might have. I hope that was a fair overview of what's available, but those two tools are really a great start to help increase access across New York City, because there are pantries not in every neighborhood, not necessarily in every zip code, but in every borough there is somewhere to get access to food. And if you can't get access there, there are different resources that might come up by doing that. So while you may not be able to access that pantry today, you'll know when a pantry was open. You can find things at your discretion and have a little more freedom trying to find food and trying to find that food safely in the times that we're currently living in. Thank you, everyone.
Great, thank you so much, Gabrielle. And I'll hand it right over to Dorella from God's Love We Deliver.
Hi, can you hear me? I'm very excited to be joining you all today. My name is Dorella Walters, and I'm Senior Director of External Program Affairs at God's Love. And I want to tell you about our services. We are an organization that's existed for more than 35 years. We started as a direct response to the HIV/AIDS pandemic, and our goal was to provide nutritious meals to individuals dealing with serious life-altering illnesses and their families, to make sure that our services could help them while they were dealing with their illness and while they were dealing with any treatment. So God's Love We Deliver is a medically tailored meal program, and we provide services in all 5 boroughs of New York City. And for our managed care partnerships, we provide services in Nassau and Westchester as well. We have a fleet of vehicles, about 26 vehicles, and they're all marked as this one is in the image, so that people know who we are and don't necessarily confuse us with other types of service providers. So what do? We're delivering medically tailored meals. We also provide comprehensive nutritional counseling and education for the individual that's diagnosed, as well as the family members that are taking care of their loved one. And we also have partnerships with managed long-term care providers as well. And who are we serving? Those that are too sick to shop and cook meals for themselves. So it may be some individuals that come to your mind at this moment. They may be experiencing something that isn't necessarily a forever situation. So that's where God's Love We Deliver comes in. It's for individuals that are in danger of being institutionalized, that may have significant limitations in terms of their normal activities of daily living. Perhaps they're dealing with the progressive stages of dementia, maybe early onset dementia, you name it, on the cusp of developing severe diabetes, and they perhaps have been discharged to the home and they may not have a home health aide or family member to assist them. So who are we targeting? We're targeting the 5% of individuals that cost healthcare 50% of all dollars. We work with organizations that provide food and nutrition across the city. So we are a partner with City Harvest as well. There are different tiers of food need and food insecurity and malnutrition in our city. So we collaborate with all of those kinds of providers, but we're providing services to the smaller number of people that may be dealing with a serious life-altering illness. And that's where they would need medically tailored meals that the dietitian is prescribing for them based on their diagnosis and their medications and any food allergies or any things like that. So God's Love is delivering over 2 million meals. We're serving over 9,000 individuals, their children and senior caregivers. We have seen that we're serving over 200 diagnoses, and it runs the gamut. And many individuals are multiply diagnosed. We have a team of volunteers that outnumber us, I guess 4 to 1, and that's how we do most of our work. They volunteer in our kitchen, they volunteer with deliveries and things like that. So 90% of all of the clients that we serve have at least a secondary diagnosis. And this is a snapshot of some of our illnesses that we serve. And while we started with HIV and AIDS, and we're still serving people that are 16% that are HIV and AIDS. And something to keep in mind, once the medication started working, we saw that people didn't necessarily need our meals anymore if they had AIDS. And that was great. That's when we expanded to include other illnesses in 2001. But what we have seen is people with HIV coming back on as a result of some side effects of some of the medications that they've been on for a very long time. Think of cardiovascular disease or lymphedema, things like that. So you just want to be cognizant of what your clients may be experiencing, and then is this the right intervention for them? God's Love We Deliver is a medically tailored meal intervention. We are not a Meals on Wheels provider. We do not have an age limitation in terms of how old someone needs to be for our program. So what is medically tailored nutrition? It includes a comprehensive nutritional assessment conducted by our registered dietitian nutritionist, and they work with our chefs to design a menu that matches or best supports the individual in terms of their diagnosis and any treatments that they may be experiencing. All of our meals are freshly prepared on site. They are blast frozen, and that is to make sure that they remain fresh. All meals are low sodium, and we can modify the meals accordingly. So if someone, let's say, starts with a diagnosis of head and neck cancer, and the doctor wants to build them up or bulk them up before they start radiation, they may start on a regular diet. But then as they begin to experience the radiation, we can modify the meals accordingly to move to soft and then minced and pureed. And if they're a renal patient, we can honor that as well. The dietitian, as I mentioned, goes through a comprehensive nutritional assessment. They work with the doctor or any of the team that's working with the individual. They also conduct normal nutritional counseling for the individual that's diagnosed and for their family members. And for reassessments, if someone is on for at least a year, they're conducting comprehensive reassessments to make sure if there have been any changes in medications or things like that. In terms of the meals that we provide, we're providing lunch and dinner for the whole family. However, please keep in mind that before the pandemic, we were serving breakfast and dinner for children because we were discovering that the children of our families weren't necessarily having breakfast before they left the home. So we modified that after the pandemic, once all the schools were closed. So they're all receiving breakfast, lunch, and dinner. And what will happen is people will get in their home. We're actually delivering to their home at a majority twice a week, but about 30% of our population has requested that we deliver 1 day a week. So what does that mean? We're delivering multiple days worth of meals to that home so that that can guarantee that the individual has greater variety in terms of the number of meals that they're going to select. So if today's, Wednesday, I may not want fish today, I want chicken, and that's where the menu that they've received in their home allows them that greater flexibility. So feeding someone medically tailored meals for 1 year is the equivalent of saving an average cost of 1 night stay at the hospital. So what do we do in addition to our meals? We recognize that sometimes we're the only person that's seeing a person for their birthday. So we honor everyone with a birthday cake. And we also deliver special holiday meals for Thanksgiving. And we're not a religious organization. So we call our December holiday a winter feast. And we'll send them things for their home, a basket. And the goal is to have them invite someone to join them. So everyone is given an extra guest meal so that they can bring people over. And then there's our concept of emergency meals. So we always prepared for the zombie apocalypse, and we got something a little different this year. So we actually delivered more than 5,000 shelf-stable meals to all of our clients in addition to their regular meals, because we didn't know how the pandemic was going to further impact them or our operations. So we wanted to make sure that they had additional food in their homes, just in case of any eventuality. So these are some images of our meals. Our containers are BPA free. So they can be reheated in a conventional oven or in a microwave. And we are serving lots of individuals. So we serve single room occupancy hotels. We work with the staff at those facilities. We want to make sure that the food is safe for consumption for everyone that we're delivering to, and that it can be safely stored. So medically tailored meals, as I mentioned, our goal is to try to lower the overall cost of care, to improve overall health outcomes, and have high patient satisfaction. And we've seen, at least in some studies that we've participated in, that we've been able to impact at least 50% reduction in hospitalizations, have individuals be more likely to be discharged to their home rather than to a facility. And in people with HIV and AIDS, that there's been a 50% increase in their adherence to medication. So how does someone become a client of God's Love We Deliver? They can either call on their own, or they can be referred by their case manager, social worker, or medical provider. The goal is, if you visit our website, and it's www.glwd.org, and there is a check Get Meals tab, and you want to check the eligibility to see if the person that you're thinking of is eligible potentially for our program. And if they do have a serious illness and have physical difficulties standing at the stove or being able to lift up groceries or anything like that, then they're likely eligible for our program. But keep in mind that our program requires ultimately an eligibility letter signed by a doctor, a nurse practitioner, or a physician's assistant. So our intention is to make sure that everyone is engaged in some kind of medical care. If they're not, then we would reach out to partners such as yourselves to see what is going on so that we can connect people to care. Okay, so what I have given to Bonnie and the rest of the team are the forms. You'll get those as a packet, but what you would do is you would download the forms. We are a HIPAA compliant organization, so we encourage you, if for any reason you're going to be advocating for your loved one or for your client, please make sure that you and your facility are listed on that HIPAA form so that we can have clear conversations with you. One thing I wanted to mention is that if someone were to call us right now and say, I need your help and I want to get meals, we will start delivering at least 10 days worth of meals prior to getting all of the forms finalized. So we want to make sure that people don't have to wait to get their meals. And all you have to do is either you could email us the forms or you can fax it to us. And I think this is my last slide. And this is how you can contact us. You just need to contact our client services department, but we're reachable by email, and the website again is www.glwd.org. Thank you so much.
Great, thank you so much, Dorella. That was so wonderful and interesting. We have some questions coming in. For those of you, if you still have your questions, now is the time to type those into the Q&A box. And we're also going to be sharing a link to the SurveyMonkey feedback form if you have any ideas for future programming, and a poll should be popping up on your screen as well. So let's dive right into some of the questions. Dorella, are you, is God's Love We Deliver able to accommodate religious and cultural diets as well?
Great question. So God's Love, remember, we're not a religious organization. We cannot provide kosher or halal meals. However, depending on how strict an individual is in terms of how they keep kosher, we have found that a number of individuals choose to be on our vegetarian or pescatarian menu. And that way they feel that they feel safe with having our meal. So it's not a strictly kosher meal. The reason being is we only have our one kitchen, and it's 10,000 square feet. However, we are exploring potentially as a strategic plan for next year to expand to another kitchen. And that has always been one of our goals, to be able to expand to kosher and halal meals.
Great, thank you. Someone is interested in learning more about food access for families in the district of office of Congresswoman Nydia Velasquez in Brooklyn. I don't know if we can specifically pull up what that area is, but maybe, let's see.
If there's a zip code that I can have, then I can use it as a sample to just search for sure.
Oh, for the zip code? All right, so maybe somebody can, for whoever asked that question, if you could at least just send us the zip code, we can do a quick demonstration search for services. And, okay. I don't know if either of you would know this, but are Meals on Wheels providers enrolling new clients at this time?
I am not sure about Meals on Wheels and their clients. However, I know the city is working with a number of different caterers and food businesses that are part of the Get Food program for the city, which delivers prepared meals I think it's 9 at a time, so that it's usually 3 breakfasts, 3 lunches, and 3 dinners. And those caterers work with the delivery as well. So that might be a good place to start if somebody is looking to access prepared meals specifically at this time.
Yeah, and this is Dorella. I would add on to that that Get Food is probably the best option to reach out to. But remember, the city's opening up in its phases. So the city is likely going to start winding down the Get Food program as we've known it. And at the same time, the Meals on Wheels providers that we're all familiar with may be ramping up to be able to do deliveries themselves. Because during the pandemic, it was all kinds of different providers providing the home delivered meals. Even congregate sites that normally never delivered were home delivering their meals to their own clients. So you just want to keep an eye out for which Meals on Wheels provider you might be thinking of to see if they're up and running. Because keep in mind, one of the biggest concerns during the height of the pandemic was that an elderly population shouldn't be out on the street delivering during the height of the pandemic. And that was a lot of the staff for a lot of the Meals on Wheels providers. But we think we're getting, we've done very well as a city, so hopefully that will improve significantly for us.
Great, thank you. For someone who's interested in volunteering with either of your organizations, how can they learn more and get involved? Dorella, you want to start?
I can go first. Yeah. So we love volunteers, and we're always looking for volunteers all year long. And even we have multiple shifts and great flexibility. So all you need to do is visit our website, www.glwd.org, and just sign up for a shift. We do have certain family volunteer shifts that would allow for children, let's say, to make birthday cards for clients or to make holiday cards for clients or placemats as well. So before the pandemic, we partnered with a lot of schools. So that's just another opportunity to kind of keep in mind if you know of a group that would want to have a task to kind of work on together for our agency, we're happy to partner.
And right now at City Harvest, some of our volunteer opportunities have shifted. There are still opportunities with our mobile markets that you can look at online. Right now, we don't have any outside volunteers working at our food rescue facility, our warehouse, to repack food. But what you can do is go on City Harvest website, and there's a section called Take Action and a volunteer portal there. Our volunteer department has recently taken a huge shift to address agencies who are definitely in need of volunteers and more resources throughout COVID. So if you sign up to be a volunteer, there's an orientation you'll go through, and then after that, opportunities will be made available to you. And sometimes those opportunities will be with an agency potentially in your own neighborhood.
Thanks, thank you. Okay, so we have a follow-up from Evelyn with Representative Velasquez's office. So interested in the in getting meals to residents in the Williamsburg and Bushwick area, and in the East New York and Cypress Hills neighborhoods. So a lot of zip codes there, and I know, Gabrielle, you have a map that maybe we could plug in a zip code or two, and Dorella, I don't know if you know offhand of programs that are available in those neighborhoods, or how this office could find out.
Yeah, I mean, I think there's probably lots of providers out in those zip codes. We work with Representative Velasquez's office already, but it may be that they're is heightened need as a result of the pandemic. So I would love to connect, but I'm sure City Harvest and the food bank and other providers have locations. A lot of locations popped up as a result of the pandemic. But now that the phases have opened, I'm sure some of those are winding down. So there may be higher need in some of those areas.
Great, thank you. I think this is a question for City Harvest. There are community centers based in developments that are interested in becoming a drop-off site and receiving food. How can that happen?
So right now at this point, we're at capacity between our agency network, which is almost fully back up and running, and the 31 additional partner sites that we're working with. We are full. However, again, on our website, our team is trying to keep track of this. So as shifts happen in availability, or if programs close because they have to go back to their regular operations or their volunteers aren't able to run them anymore, we keep that list active and keep communicating with programs who are interested in running different emergency pop-up sites. And I think that also can give you some information around some of the requirements, because there are requirements around refrigeration, availability, etc. If I'm gonna I'm gonna open that map back up in a moment in the Williamsburg area, just to see what's going on there for you guys. And if you give me another moment, I will also find exactly where that form is located on our website, so you can get that back to us. And again, people are responding and still reaching out to vet and give information back, so we don't have folks waiting for potential opportunities.
Super. Okay, Gabrielle, while you're pulling that up, I have a couple questions for Dorella. Is the birthday cake and special holiday meals for everyone enrolled in God's Love?
Yeah. So even if there's a 2-year-old, yes, they're getting a birthday cake. Our goal is to really just make sure that we honor those special moments in someone's life, because when you're not feeling well, sometimes that kind of slips away, and we want to just make people feel better on that day.
Oh, that's lovely. And are you able to tailor meals if a client has allergies?
Yes, the dietitians will go through those questions. What kinds of allergies does a person have? But for example, let's say someone is strictly gluten-free. Right now, we're not able to do that. But if someone says they're, allergic to onions or things like that, then we handle all of those kinds of restrictions. So to learn more, just, reach out to us, and the dietitians can answer those specifically.
Thanks. And Gabrielle, do you have that pulled up yet for the Williamsburg area?
I do. Just one moment, I'm sharing now.
Thanks to those of you who've been filling out the poll. Please continue to do that and to send us questions. We have about 10 minutes more if you have any more questions. Okay.
So this green, I'm using a Greenpoint Williamsburg as just the baseline, and so all I put in, I Googled whatever zip codes are kind of in that area. 11249 popped up. So this is that Williamsburg area specifically, and then a little bit more into Greenpoint, and then coming down into Bedside. So just to give you an idea of what's available, we do have a mobile market that is in Bedside. There are many agencies that are in the area, and also I will make a point of just these red dots specifically indicate emergency pop-ups, and so those emergency pop-ups we send those locations lots of food, often by the tractor trailer load, and so they either receive fresh produce from us, or they sometimes receive boxed produce That is through what is called the CFAP program. It's a federal program that through the USDA that is providing pre-packed produce boxes for folks to be able to take home. In terms of prepared meals, many sites do get prepared meals, but it's hard to indicate specifically who is getting prepared meals. As a rescue, our inventory is in flux and it's moving around the city in different ways on a daily basis. But you can also see out a soup kitchen specifically that might be getting those meals.
Great.
And then I will also just take a second to find that form for folks interested.
And Dorella, I don't know if you already covered it, but do you are there specific eligibility criteria to access your program?
Yeah. So the person has to have a serious life-altering illness and have physical difficulty shopping and cooking meals for themselves. So some people may have lots of people that come to mind that fit that kind of description, and that's fine, right? It's not a forever circumstance. However, there are some diagnoses that are consistently recertifying because this is a long-term experience for them, right? Think people with multiple sclerosis or people with lupus or Alzheimer's disease, et cetera, progressive illnesses. But there are other circumstances where someone may be dealing with severe diabetes and congestive heart failure and, you know, has had something kind of a blip on their health chart at a moment in time, and that's where we get the referral. And we're serving them for anywhere from 6 to 12 months, or however long. Some doctors do shorter intervals as well.
And in terms of insurance status or for people who are undocumented, are there options?
So we serve everyone. Someone's citizenship status isn't anything that we're interested in. We just want to make sure that someone's engaged in some kind of medical care, and our state is very robust in providing that for all kinds of individuals. So, you know, just be cognizant of that. If someone's going to any clinic or whatever, it's fine, you know. As soon as the nurse practitioner or doctor can sign off on the note, then they're good to go in terms of being enrolled for the service.
Another follow-up question for you, Dorella. You stated a person would be given 10 meals, presuming eligibility. How long in average is it taking after someone submits the form to get a response of approval or denial?
So we try to work with an individual to help them get that eligibility letter for the program, right? So people that are closer to being eligible for our program are the ones that we kind of get started on the meals. And we'll fax the note to the doctor or send the request to the doctor to get that back. So we often have a quicker turnaround time. However, sometimes if a person self-refers and they have not been to their medical provider in quite some time, then that will cause a delay. And then that's where there's an interruption in our service. But our intention is to prompt the person to actually go see the physician and engage in care, right? Make sure you check everything to see that you're taking the right medications and things like that. But we do have a high number of individuals that get everything to us prior to us even conducting that first interview. So my hope is that many of the people on this call, depending on the facilities that you work with or partner with, that we would be able to kind of strengthen that so that then when you know that someone needs us, you can just get the forms over and everything's good to go, and all we need to do is just talk to them and confirm the address and get services over to them.
We have a comment here that God's Love We Deliver has been great. They used to have their kitchen in Brooklyn and delivered to a host of people with HIV and diabetes. Thanks. Just a little compliment in there. Great.
Thank you. Yes, we were in Brooklyn while we were reconstructing the building we're currently in. And we are rapidly outgrowing the building we are currently in. So we may go back to Brooklyn, and we may, we're looking for other locations actually. So that's part of our strategic plan. So we're excited. The city is evolving in terms of its needs. The pandemic revealed a lot that we were already aware of. But we're excited to kind of explore other populations that we could be serving, other diagnosis groups, things like that.
That's exciting to hear. City Harvest is also moving to Brooklyn. So we are currently in Long Island City, and then this time next year we should be in our new, much bigger, not so much needed bigger space in Sunset Park. I found this form for you all, by the way. It is located on the same page as Get Food Help. I'm gonna share my screen once again.
And if there's a direct link, if you want to pop that into the chat box.
Yes, it's that same page. So it'll take you to the right below the food map. For an organization interested in receiving food to distribute, there's a form here, and this is the form that will come up. So all of this information we keep pretty organized, and staff regularly check in to just vet and see what is possible, what's not, and if anything, direct you to resources that might work better for you. And it's a longish form, but that's really a lot of the information that we have to begin considering who we can serve, because City Harvest moves food by the ton, and a pallet of food alone is about a ton. So we need a lot of space and capacity to bring on new partners.
Yeah, and do you work with supportive housing providers?
We do work with some supportive housing providers. Pardon me. Many of them we've worked with for many years in terms of bringing on many more agencies. At this time, I don't know what that looks like, but we definitely do work with a few supportive housing sites.
And Dorella, do you deliver meals to kind of non-residential areas like a homeless drop-in center or any other kind of transitional programs like that?
So the answer is yes, but it depends on their capacity to safely store the meals. So we end up working with the staff at those facilities just to have a better understanding as to whether the staff can safely hold meals, or if there's a congregate space, let's say, where people can have their food safely stored without being accessed by others. So that's always been the concern. So, and if someone is at a facility that we can't drop off at, that's where the staff are really clear that they have to help trying to set up a space where we can actually deliver to. That's why I mentioned earlier that we do go to a lot of SROs. We do have different kinds of homeless shelters depending on how they're set up. And the staff there are able to help us kind of monitor it for a particular individual or numbers of individuals.
That's also a challenge we face. Food safety is at the forefront of our daily operations, and so because the volume of food that we deliver is often quite large, we do have trouble trying to accommodate organizations or partners that don't have ample refrigeration space or can't hold things overnight. It's always a challenge, but we try to work through it.
We have an appeal for God's Love We Deliver to come to Brooklyn, here from Evelyn Cruz at Nydia Velasquez's office, encouraging you to check out Williamsburg on Johnson Avenue, off Morgan Ave on the L train. There are several 10,000 to 15,000 square foot buildings leasing, and community welcomes God's love we deliver over luxury development. So something to consider.
Yes, thank you so much.
Yes, great. All right, well, I think that that was our last question, and we are just 1 minute away from 5 o'clock, and this is a time of day that we do not want to go over. So I want to thank our speakers, Dorella and Gabrielle. Thank you so much for sharing about your programs and just for the great work that you do. I'm sorry that you are so in need right now, but very grateful that you are here and providing these really vital services and meals and love to people. Everyone, thank you for attending. We'll be sending out all these slides and materials in this recording, and we hope that you will join us again. So thank you all very much.
Thank you.
Thanks. And we'll leave this poll open until completing it. We'll just leave it open for just another minute. All right. Thanks. For those of you still here, if you haven't yet, please feel free to fill out our feedback form and let us know what other topics would be helpful to you. All right, thanks so much.